So recently, ourselves and colleagues have published a very nice overview in the Journal of Thoracic Oncology, looking at the utility and role of immune checkpoint inhibitors in thoracic malignancies. This is a sort of state-of-the-art review of everything that we know about checkpoint inhibitors, and gives the data together with clinical expertise. And it's a really, really good solid starter for people who are relatively new to the field, people who've been using checkpoint inhibitors but haven't necessarily got a feel for all of the data. It reviews the different checkpoint inhibitors, how they've been developed, how the dose has been identified, what the scheduling has been, many of the uncertainties that surround that. Why do we use a fixed dose rather than weight-based dosing? What are the indications for checkpoint inhibitors? And it goes into many of these facets in a lot of detail. It also explores clinical scenarios. What is the role of steroids in patients with checkpoint inhibitors? What is the data to support that? What is the data to support checkpoint inhibitors out with the clinical criteria that were into the clinical trials, so such as patients with low-level autoimmunity, and gives a clinical overview of how we use these agents, their licensed settings, and also biomarkers. What do we know so far? PD-L1 seems to be the best and most validated and the robust biomarker, but where are we with other biomarkers such as TMB and the role of potential negative predictive biomarkers such as STK11 and KEAP1 mutation? So very good primer overview of where we are with the space of checkpoint inhibitors in thoracic malignancies for the time being.